Okay, so Neuralink, right. Elon Musk's brain-computer interface company. It's aiming to, link our brains with computers. Wild stuff.
It's definitely a fascinating topic, that's for sure.
Yeah, for sure. But, like, beyond just the headlines, what are they actually doing? The tech, is it really going to change everything
Right.
like they're saying? That's what we're diving into today. We've got articles, reports, even some official Neuralink stuff to
Yeah.
go through.
Yeah, the potential impact it's huge. But it also raises so many questions, ethical ones, practical ones.
Exactly. It's not just about cool sci-fi gadgets, right? This is a company that wants to, like, literally
Mm-hmm.
rewrite how we interact with the world,
Yeah.
how we treat diseases, how we think, even how we define, ourselves even.
Yeah,
Let's
absolutely.
start with the basics. Neuralink, founded back in 2016 by, well, I mean, who else?
Elon Musk, right?
Musk, obviously. With a team of neuroscience and engineering experts. They've been pretty secretive, though, but they have started to share some of their progress.
Yeah, and what's really fascinating to me is that Neuralink isn't just about making a connection
Yeah.
between the brain and a computer. It's their goal is to develop this like generalized brain interface, one that can treat a whole bunch of different.
So we're not talking about, so hold on, we're not talking about just like science fiction anymore. This is real world applications.
Yeah, real world stuff.
Okay, give me an example. What kind of,
Think about paralysis, blindness, deafness, even things like
yeah.
depression, anxiety. All that's tied to brain activity.
Wow. Okay. So it's easy to get caught up in the hype, though. But look at the actual technology here, this brain interface.
Yeah, good idea. So they're using these ultra thin threads,
Mm-hmm.
thinner than a human hair, and they're implanted.
Okay, so we're talking about implanting things
Yeah.
directly into the brain. That just
Yeah.
seems incredibly delicate. How do they even do that without, causing damage?
That's where their robot comes in. The surgical robot. It's amazing. It's designed for such
Yeah.
precision. The robot handles putting these threads in, so there's minimal risk to the surrounding brain tissue.
So they basically built a sewing machine for the brain.
Kind of. I mean, obviously it's way more sophisticated, but yeah, kind of.
Wow.
The needle is thinner than, like I said, thinner than a human hair. It can put in something like 6 threads per minute. And that precision, that's key. You have to have that to minimize damage, make sure the implant lasts.
Incredible. But what about the device itself? Where does all the data go?
So the threads connect to this. It's called the N1 implant. It's a small device.
Okay.
And it's designed to be like totally invisible. You wouldn't even know it was there.
So no clunky external hardware or anything?
Yeah, it's all internal.
That's pretty amazing.
Yeah, the N1, it's got the battery in it, and that charges wirelessly. And then the chips that process all the neural signals.
So they're taking these raw electrical signals, right?
Uh-huh.
From your neurons and then like translating that into something that
Yeah,
that a device can actually use.
that's the magic, right? The algorithms and the machine learning models they're using. The N1 implant transmits the data wirelessly to a device that's running the Neuralink application.
Oh.
And that application decodes everything.
So you could like control your phone with your thoughts.
Yeah, or a computer.
That's incredible.
Imagine like someone with paralysis, right? They could think about that, regain lost mobility, not through physical therapy or anything, but by basically interfacing with computers directly or prosthetic limbs.
Yeah, that's huge. But okay, I have to ask, what about the downsides?
Mm-hmm.
I mean, sticking something in your brain, even if it's tiny,
Right.
there's got to be some risks there.
Of course. I mean, anytime you're, doing something like that, there are going to be risks, infection, with any surgery, but especially when you're talking about the brain.
Right, of course.
Yeah.
And what if the device itself malfunctions somehow?
That's a valid concern. Neuralink says they've designed the threads to be, biocompatible. So, minimize the risk of rejection.
Okay.
But they'll need long-term studies, right, to figure out how long they really last.
Right.
They've tested a lot on animals, but,
It's not the same.
it's not the same, right? Things could be different with people.
Okay, so yeah, I mean the ethical side of this too. This is a big deal.
Huge. Absolutely huge. I mean, who controls the tech? Who controls the data it's collecting?
Yeah.
What happens to your neural data?
Yeah. Is it going to
Right. Is it being sold?
Right.
These are all things, we have to address.
Yeah, I mean, could this be used to like, control people's minds?
Oh.
Or steal their thoughts?
Yeah.
I mean, it sounds crazy.
It's a possibility. I mean, it's definitely a possibility. Although Neuralink says, they're developing it for good.
Right.
Said they're committed to, responsible innovation, all that. But
we still have to be careful, right?
absolutely, we have to be, yeah.
So it seems like their ambitions go beyond just, you know,
Yeah.
treating diseases.
Yes.
Haven't they said they want to? Like, use this technology for even bigger things.
Right. Musk thinks, right, that AI could be a threat, like a threat to humanity.
Yeah.
And he sees Neuralink as a way to, keep up with it, maybe even, merge with it.
So, like, augmenting our capabilities.
Yeah.
We're talking. Enhanced memory, telepathy.
Yeah, all that. It sounds crazy.
It does.
But their work suggests, it might be possible.
Wow.
They're actively researching this stuff.
So you're telling me, like, I could download information, straight into my brain, or talk to someone with just my thoughts.
That's the idea.
It's both exciting and terrifying at the same time.
It really is.
It makes you wonder, what does it even mean to be, to be human in a world like that?
Yeah, that's
Okay. Let's bring it back to the present though. Neuralink, they have the tech, they're working on these challenges. What's next for them?
Well, they actually they announced back in January that they implanted their first device, in a human.
Oh, wow.
Yeah.
Really, I totally missed that.
Yeah.
Yeah.
Yeah, it was big news, at least in, scientific circles.
Wow.
The patient, they have quadriplegia,
Mm-hmm.
and the goal is to, let them control like computers and stuff with their thoughts. The trial's still going on, but it'll be amazing to see what happens.
It feels like, I don't know, a turning point.
Yeah.
Just for Neuralink, but for like this whole field, brain computer interfaces. This is we're like on the edge of something really big.
Yeah. Yeah. And what's interesting is Neuralink's not, they're not the only ones doing this, right?
Mm.
There are other companies like Synchron.
Right, Synchron, yeah. They're taking a kind of a different approach though, aren't they? Something about using blood vessels instead of going directly into the brain.
Yeah, so they have this thing called a stentrode, and it goes into a blood vessel in the brain, so you don't need open brain surgery.
Yeah.
It's less invasive, so that might be more appealing for some people.
Right, less risk, probably faster recovery, all that. But are there downsides to that approach? Like, does it, I don't know, limit what they can do?
Yeah, that's the big question, right? Neuralink's, going right into the brain, so they're maybe getting more data, more bandwidth, you could say.
Okay.
But Synchron, they've already got like FDA approval for their human trials, so they're definitely in the race.
It's like it really is like the Wild West out there right now.
It is.
So much happening, so fast.
Yeah, and it makes you think, right? This is technology. Stuff.
We do.
Make sure it's done, responsibly.
Yeah, absolutely. Okay, well, I think that's about all the time we have for today. Any final thoughts before we wrap up?
I think it's, we're at the beginning of something really, really new here. The line between us and technology, it's blurring.
Right.
Neuralink is like right there on the on the front lines.
Yeah.
It's exciting, but there are, real risks too. We have to be aware of that.
We do. Okay, well listen, this has been a fascinating look at Neuralink. I mean, we just scratched the surface really, but
yeah, there's so much more to learn.
A lot to think about from the tech itself to, like you said, the ethical questions. It's going to be interesting to see where things go from here. That's for sure. All right, well, thanks for joining me today.
Yeah, thanks for having me.
This has been another deep dive. We'll see you next time.